I'm very excited this morning to present our first speaker. She speaks to our cardiology symposium every year, talking to our cardiac patients about heart disease being a foodborne illness, and our cardiologists refer their patients to her for expertise in helping them adjust their lifestyle to have a great impact on their health. I'm very concerned that EMS is often a walking cardiac emergency, so I have asked Dr. Beth Motley to come and talk to us today, and I am so excited about the information that she has to share.
Thank you guys all for joining today. I'm going to start by just giving you a little bit of background. I am a family medicine doctor, but my subspecialty is lifestyle medicine, and that's been around as a subspecialty since 2017. Lifestyle change is first-line therapy for almost every diagnosis. If you look at the guidelines for hypertension, for high blood pressure, you will see number one, like change diet and lifestyle, and really little writing, and then number two is, all right, let's start some medicines, da-da-da. But a lot of physicians aren't well trained in counseling patients about changing their diet and lifestyle, and so we'll often jump right to giving medications. So I got interested in lifestyle medicine before I even really knew what it was. So I'm from outside of Boston, and I was a figure skater growing up. And so for me, food was fuel. If I could fuel my body well, I would be a better performer. And I went into medical school, didn't feel particularly drawn to any one specialty. And so I said, you know what, I'm going to spend my elective time and go around the US and work with some different doctors that really focus on nutrition and helping their patients to be healthier. In my training, one of the things I found is that a plant-based diet is foundational. And we'll get into a little bit more of what that means. But almost every physician was recommending some form of a plant-based diet for heart disease, for diabetes, for cancer. So let's jump in and talk a little bit more about heart disease. So there are some pockets of the world where there is no heart disease. So that's rural China, Papua Highlanders, Central Africa, and the Tarahumara Indians. In the United States, however, red is bad. Yes, red is heart disease. Major problem in the United States. We all know that. Everyone in this audience knows heart disease is the #1 cause of death in our country. About 1 in 4 people die each year. 700,000 have a heart attack every year. We all know heart disease is a major problem. So why is heart disease so prevalent in the United States? It's the food. It is the food we are eating. The food we are eating is foundational to our health. So we're going to talk about a few different things. We're going to start by looking at the steps in atherosclerosis. We all had biology and pathophysiology at one point, but just brushing up on those steps. We're going to look at some of the research of our lifestyle medicine pioneers, and we're going to talk about what foods we should actually be eating. So to start with, these are our coronary arteries. Coronary means heart, so these are the arteries that supply our heart muscle with blood, so we can keep them oxygenated and keep them pumping and functioning normally. So how do we get from nice, clean coronary arteries to one that looks like this, to one that's filled with plaque, and that plaque we know leads to heart disease? So here is a nice, healthy blood vessel. A blood vessel has 3 layers, and the innermost layer is the endothelium, and that is 1 cell thick. It's that pink layer right in the middle. And despite seeming to be an insignificant little layer, the endothelium has some very important functions. One of the most important functions it has is serving as a barrier between what's in the blood and in the walls of the blood vessel. It also secretes certain enzymes that will prevent the blood from clotting. And all of these things help to allow that blood to flow smoothly through the blood vessel. So how do we get from a nice clean artery to one that is filled with plaque? So first of all, we have to have some irritants present. And one of those irritants is LDL cholesterol. LDL, that is our bad cholesterol. I always remember L for low. We want that number to be low. So we have LDL cholesterol, we have cigarette smoking, tobacco. That's a bipartisan issue. We can all agree cigarette smoking is not good for us. And then high blood pressure, pushing on the walls of the artery. And all of these irritants together start to damage that layer of the endothelium, and it becomes compromised. Okay, so now the endothelium is compromised. The LDL floating around in the blood sees that and it says, oh, that looks like a cozy little place to settle. And those LDL particles start to build up within the artery wall. And we call this a fatty streak, and we see fatty streaks as early as 10 years old. So if you look at autopsy reports of 10-year-olds, that's when we start to see the fatty streaks. So we think of heart disease as an issue that affects at least middle-aged people, but we really begin to lay the foundation for heart disease in our youth. Those LDL particles in the endothelium, now they start to oxidize. They become more inflamed, they become oxidized, and the body says, we need to fix this. So this process alerts the white blood cells, the monocytes, to come to the area to try and clean up. So these are our monocytes. They turn into little Pac-Men, little macrophages, and they say, you know what, we'll just gobble up this mess. We'll clean it right up. And there they are trying to gobble up all those particles of oxidized LDL. So those macrophages, they die off and they become foam cells. And this process continues. Those irritants continue to enter the cell wall, enter the endothelium, laying down. We're getting more and more of a pile building up. And then those foam cells release cytokines. Those are those little purple dots. They say, help, help, we need reinforcement, we need backup, like something's going on. And those cytokines arrive and they alert more monocytes and macrophages to the area. You can see this is getting pretty messy, right? And now we call this a plaque. Once we have the plaque, the body says, okay, all right, whatever we were doing wasn't working. Let's try another method to try and clean up this mess. So instead of clearing it, we'll just try and hide it, right? And so the blood vessel starts to secrete smooth muscle cells into the plaque, hoping to sort of cover it up. And those smooth muscle cells will release collagen and elastin to put a cap over the area. You know what? We'll just sweep it under the rug. Here we go, just put a little cap around it, no problem. And that will deposit calcium into the plaque. So we also see calcium building up in that plaque. And if we're familiar with a coronary calcium score, that's a type of imaging we use that looks at how much calcium is in those blood vessel walls, right? So we do not want this. This is not a good process to have going on inside your coronary arteries. And we know as we narrow that area, the blood is going to flow more quickly through that area. And this can cause the fibrous cap to rupture, which is not good. And then we get a clot that forms in the area and causes that blood to be stopped and not able to flow through the vessel. And this is what causes the downstream tissue to die off. A very similar process occurs in the heart as occurs down there. So erectile dysfunction and heart disease really go hand in hand. Whether you're clogging up the arteries in your heart or down there, it's all the same process. 40% of men have erectile dysfunction by age 40, 50 by 50, 60 by 60. This is almost like STDs. Everyone has it, but nobody talks about it. But as a family medicine doctor, we get to talk about it in the office. So my husband is 39, so I have him on a plant-based diet. So let's look at the research of some of the lifestyle medicine peers. So we sort of went through the science side. Now let's look at the clinical side. So Ansel Keys, he was one of the pioneers looking at the relationship between diet and heart disease. Cover of Time magazine many, many years ago. And he is most famous for the 7 countries study. So this is a study that looked at 12,000 middle-aged men in 7 different countries over 10 years and also looked at their eating habits. So he found that countries with higher cholesterol levels in their blood, higher serum cholesterol, had a higher incidence of heart disease. We can see on the x-axis, that's our cholesterol level. On the y-axis is risk of death from heart disease over 10 years. Pretty linear relationship. He also found that countries consuming more saturated fat had a higher incidence of heart disease. So saturated fat, as we know, can turn into cholesterol in our bodies and is the #1 contributor to high cholesterol levels. So he found that 80% of the variance among cholesterol levels could be explained by differences in the diet that those individuals were consuming, especially in the amount of saturated fat. So we know that cholesterol is a hormone. Cholesterol is only found in animal-based foods. At the same time, these foods are also our #1 source of saturated fat, which turns into cholesterol in our bodies. So he found that in Finland, heart attacks were 14 times more common than in Japan. And in Finland, they were consuming about 7 times more calories from saturated fat than they were in Japan. Average cholesterol in Finland was almost twice as high as it was in Japan. This is a study of 350,000 people over a 10-year period, quite simply finding that higher cholesterol levels led to higher risk of fatal heart attack. And one thing a lot of people say is like, oh, these are all observational studies. We need to do some more randomized controlled trials. And randomized controlled trials, they are great when we're talking about new drugs that are coming up in the pipeline. But when it comes to nutrition, our observational data and epidemiological data is really what we have to rely on. So this is a look at risk of heart disease mortality against cholesterol levels. So on the x-axis, we have the serum cholesterol level. And then on the y-axis up here, we have the risk of death from heart disease over a 6-year period. And what we find, quite simply, as our serum cholesterol level goes up, so does our risk of death from heart disease. And what's really interesting is that they found that 25% of all fatal heart attacks occur in people with a total cholesterol of 180 to 210. So in the United States, our guidelines will call a total cholesterol up to 200 normal, but that might not be the best guideline if we want to avoid heart disease. So even if your cholesterol is at the higher end of normal, you can still be at very high risk for heart attack. So this is Dean Ornish. He is the winner of the 2015 Lifestyle Achievement Award by the American College of Lifestyle Medicine. He has done some incredible research over the last few decades looking at diet and heart disease. Recently came out with a book called Undo It, which I highly recommend. This is one of his landmark studies, Intensive Lifestyle Changes for Reversal of Coronary Heart Disease, from about 20 years ago. And he took a group of about 50 patients with heart disease and split them into 2 groups. One group was the Intensive Lifestyle Change group, and the other group was Usual Care. The Intensive Lifestyle Change group had a program that included a more plant-based eating style. I like the term plant-based because it describes what you do eat, the fruits, vegetables, whole grains, beans. You'll hear the term vegan used a lot. I don't like that term as much because it describes what you don't eat, right? Plant-based diet is more descriptive. And in his study, in the Intensive Lifestyle Change program, their plant-based diet naturally is going to be less than 10% of calories coming from fat. Fruits, vegetables, whole grains, beans, not very high in fat overall. Included stress management, smoking cessation, aerobic exercise, and group support as well. And he found that after 5 years, those that were in the Intensive Lifestyle Change program had significant reversal of their coronary artery disease. So this is a big deal, looking at reversal. Can we actually be forgiven for all those mornings that we have had eggs and bacon? Yes, you can. You can actually reverse that plaque buildup inside the vessels. Compared to the Usual Care group, we saw disease progression, as we would expect. So he found that after the Intensive Lifestyle Change program, 85% of participants had regression of their plaque buildup. 90% had a drop in chest pain, which is a big deal for someone who walks around with angina on a daily basis. Significantly fewer cardiac events, and massive improvement in blood flow in the coronary arteries. The program helped patients to avoid cardiac procedures, saving nearly $30,000 per person after 1 year. So much so that he was able to convince Medicare to adopt his program. Caldwell Esselstyn, he is another one of our trailblazers within lifestyle medicine. This is the #1 book I recommend to my patients who have heart disease. It's called Prevent and Reverse Heart Disease. He has done lots of research. I like this study because I think it's most representative of his work. And it was published in one of the family medicine journals. So this is mainstream medicine. This is nothing hokey. So this was a study of 200 patients with heart disease. And intervention was to put them on a plant-based diet, whole foods, meaning single ingredient foods, unprocessed as they exist in nature, plant-based, based in plants, fruits, vegetables, whole grains, beans. He wanted to know how many of those patients are going to adhere to his recommendations and how many cardiac events are they going to have. Okay, so what did they eat in the intervention group? Fruits, vegetables, greens, whole grains, beans, lentils, etc. Added a little bit of flaxseed and B12 in future iterations of the study. He had them avoid oils, processed foods, basically every animal-based product. So you might look at this and you're like, well, what's wrong with oils, right? I mean, I thought olive oil was good for us. So oils are the most calorie-dense food on the planet. 1 tablespoon of oil is 120 calories. So for the vast majority of his patients, they don't need to be getting extra calories. They need to be cutting calories. They need to lose weight. And so if you're trying to cut calories, adding oil to foods is definitely working against you. If you have a bowl of broccoli, let's say it's steamed broccoli, it's going to be about 30 calories maybe. Now let's say you've prepared that broccoli with 2 tablespoons of olive oil. That 30 calories is now 270 calories, 90% of which come from the oil. So in order to help his patients lose weight, he recommends avoiding some of these more calorie-dense foods, in particular the oil, but also this is why we see the high-fat plant foods like the avocado and the nuts on here, because they can really pack in a lot of calories in a single bite. So he found that 89% of the patients in the group were adherent to the diet. So like I was saying, they feel so much better, they get rid of their angina, they lose weight, they have more energy. There's no reason they would want to go back to their old eating style. And of those who were adherent, only 0.6% had a cardiac event in the following 5 years. So out of the 177 patients who adhered to his eating style, only 1 of them had a cardiac event in the next 5 years, compared to 62% had a cardiac event in the non-adherent group. So those are pretty significant differences. So these are arteriograms before and after. We can see here, this is real thin, right? And so we have pretty compromised blood flow through that area. 32 months later, look how open and clean that blood vessel is. These are PET scans, and we can see up here, compromised blood flow, and then up here, it's nice and open. And this is 3 weeks on a plant-based diet. The results confirm the capacity of whole foods plant-based nutrition to restore health in there is nothing further we can do situations. The only side effect you're going to have from a plant-based diet is maybe a little gas in the first few weeks, but typically there are no risks to a plant-based diet. So in his expert opinion, to arrest and reverse heart disease requires a blood cholesterol less than 150. The NIH National Cholesterol Education Program tells us that a 1% drop in cholesterol will lead to a 2% drop in heart attack risk. So if we can drop our cholesterol 20%, that is a 40% reduction in heart attack risk, which is very significant. Genetics play a minor role in determining our cholesterol levels. Yes, we do pass down our genes, but we also pass down our recipes. And so when we hear heart disease is running in families, we have to know that it is not all due to genetics. So what should I eat? We tell patients we're going to aim for a more plant-based eating style, especially in South Carolina. This all seems very, very foreign. So let's start by looking at a few different protein sources. We have chicken, salmon, steak, black beans. We're going to look at 100-gram servings of each, or about a half-cup serving of each of these foods. So right off the bat, as I mentioned, cholesterol is only found in animal-based foods. Cholesterol only found in animal-based foods. Plant-based foods contain 0 cholesterol. At the same time, saturated fat that we consume turns into cholesterol in our body. I got all this information from the USDA database. I tried to pick what I thought would be representative. Chicken breast, meat only, baked, not as much saturated fat in this version. Salmon has some saturated fat. So a lot of people say, oh, I gave up red meat, I switched to chicken and fish, which is, great for cancer risk, but in terms of heart disease, all of these things are fairly similar. Fiber is only found in plants. Fiber helps to stick to the cholesterol and escort it out of our body. Lots of fiber here, no fiber, and no fiber in the chicken, no fiber in the salmon. So it's not just that we need to avoid the damaging foods, the animal-based foods that contain more cholesterol and more saturated fat, but we need to maximize the fiber. So some people will say, well, what about egg whites, right? They don't really have much cholesterol, saturated fat. Is that a good choice? Egg whites, sort of neutral, but if you have roughly 2,000 calories to spend every day, you want to spend those calories on the richest fiber sources to help you to lower your cholesterol. And as we know, egg whites don't contain any fiber. Cholesterol is only found in animal-based foods. These are also our main source of saturated fat, which our bodies can turn into cholesterol. Fiber helps to lower our cholesterol and is only found in plant-based foods. So what should I eat? No, No, this is not a rabbit food diet. Someone asked in one of my last talks if that meant they could eat the rabbit. No, don't eat the rabbit either. So for example, this is what your dinner might look like. Lentil tacos, grain bowls, loaded sweet potatoes, mixed bean chili, African peanut stew, black bean tortilla soup, vegetable fajitas, spinach and mushroom grits, vegetable tamales, rice and beans, collards, black-eyed peas, sweet potato black bean quesadillas, stuffed peppers. So this is not a starvation diet. People hear about plant-based diet, they think they're gonna just be eating lettuce and tomato for the rest of their life. This is not calorie restricted. The idea is that if we choose these foods, fruits, vegetables, whole grains, beans, they tend to be very low in calorie density overall, so we can eat until we are satiated without consuming too many calories. Where to find recipes? These are some of my favorite resources. Minimalist Baker's probably my favorite because it's all 10 ingredients or less, half an hour or less, not too many pots and pans out. Forks Over Knives, they've got some great recipes on their website. They've got some great cookbooks, How Not to Die cookbook, lots of great resources there. Plant-based friendly local restaurants, there are a lot of them in South Carolina. It takes a little bit of research to find them all, but Zoe's, Pita House, Sunbelly Cafe, Mekong is great, Vietnamese, almost any time that you're doing ethnic food, whether it's Swad, Indian food, or Thai, like basil. Ethnic food can be done plant-based very well. We love our veggie sushi, Mexican, also very easy to do plant-based. And now, I want to go through and show you a few of my patients' lipid panels to show you the power of changing your diet. In its broadest sense, when I say a plant-based diet, it means at least 95% of your calories coming from plant-based foods, right? And if you're eating roughly 2,000, that would mean less than 100 calories a day from animal-based foods, which is not very many. When I work with patients, I find that for a lot of people in the United States, complete abstinence is easier than perfect moderation. You're gonna go crazy trying to limit yourself to 100 calories per day of animal-based foods. At the same time, in the research by Caldwell Esselstyn and Dean Ornish, they used 100% plant-based diet. So I encourage patients, if you are working on reversing your disease state, let's be pretty strict until we meet our health goals, and then if you want to loosen up, that's up to you. So this was a patient, she's about 50-year-old female. She's always had high cholesterol with an LDL 180 to 190. She switches to a plant-based diet, and within 3 months, she drops that LDL 70 to 80 points. And I like to have sort of a before and after of the lipid panel, because the patient can see that, and then they can prove to themselves what they're capable of. This is someone else. This patient, obviously very overweight, weighing around 300 pounds, 3 months on a plant-based diet, does drop a lot of weight, drops LDL cholesterol 80 points. Here's someone else. This is my slow and steady wins the race. He was on a statin with an LDL of 116. 6 months later, we had him both off the statin and his LDL still dropped 56 points. Someone else dropping that LDL from 200 to 126. This was a young male, about 26-year-old male, and he was doing the keto diet, and I had to really wear him down to get him to try plant-based. But he did. Not only did he lose 25 pounds in 7 weeks, but he dropped his LDL 74 points. Someone else, 194 down to 121, 152 down to 96. This is a couple I was working with. Up here, we see 6 weeks on a plant-based diet, drops LDL 80 points. This is 2 months on a plant-based diet, 8 weeks, drops LDL 75 points. Some people look at this and they say, well, yeah, that's a big drop, but why are these still elevated? And so a lot of times, these people have weight to lose also. And they'll see a significant drop in LDL at the start, and then as they continue to adhere and lose that weight, that number will come further down. So if you are looking for further reading, these are the first 2 resources that I give my patients. The Forks Over Knives documentary on Netflix. And I always say you have to watch it with your family members, otherwise you will watch it and you'll be that crazy person. But if you can get the whole family on board, I think that is so much more successful than trying to do things on your own. Prevent and Reverse Heart Disease by Caldwell Esselstyn. There is also a documentary that just came out a few weeks ago. I don't know what that accent was. A few weeks ago called The Game Changers, and it's all about athleticism and plant-based diets. So that is another one I would highly recommend. I also have a Facebook group, Food is Medicine Greenville. I'll post interesting topics on food and disease and try to keep up with the current events in the nutrition world also. So what questions do you guys have? So he's asking, do you have to jump all in or can you wade in the water, right? So I do often ask people, are you a wade in the water person or are you a cannonball person? I'm a cannonball person. I rip Band-Aids. Like, that's just easier for me to go all in. But for a lot of people, they need to ease their way in. And people might start by saying, you know what, I'm just going to change my lunch every day to plant-based, which does require a lot of planning. You might be at work, you're out and about, you need to think about what restaurants you're going to go to. So some people do ease their way in. When it comes to reversal of coronary artery disease, the research we have is based on these physicians who recommended 100%. It would make sense that the more you do, the better. The research we have, again, is on those 100%ers. So I don't know. I don't know what level of compliance you would need to reverse your coronary artery disease. Surely by easing in, you can prevent yourself from worsening that coronary artery disease. But again, I usually tell patients, when we're starting out, or if we really want to achieve that health goal, let's start by being pretty strict from the start. Heart disease is great, but my favorite diagnosis is actually diabetes, because you can see those numbers change so quickly. And in sick people, it's people who've had a heart attack, they've been started on insulin, cancer diagnosis, or people who are watching their parents get sick, watching their parents die, and those people are the ones that are motivated. Although it is inconvenient, once you start doing it, it becomes very easy and people feel better. They lose weight, they have more energy. That's how we get compliance, is because they feel better. I'm not forcing them, and although I do run into a lot of patients at the grocery store because I live right around here, you know, they're not, they want to do this, they want to feel better, and so I find good compliance, and the ones that aren't compliant probably don't follow up with me, so. So she's asking about fasting. So fasting is something that's been in the media a lot lately. I think fasting is great. If you look at all those studies that say breakfast is the most important meal of the day, they're pretty much all funded by General Mills. So fasting is a nice way to cut calories. Almost all of the patients I see probably want to lose some weight also. It can be difficult to expect 100% perfection out of yourself. And so fasting, the most common way I see it done is intermittent fasting, and people will only eat between noon and 8 p.m. So they entirely skip breakfast. And when you skip breakfast, what was that study? I think you are able to reduce overall your calories in a day by about 200. So it is a way for people to sort of jumpstart the weight loss, especially when you might not be entirely perfect later in the day. It's a way to cut calories. Cutting calories helps you lose weight, which helps also for you to get your cholesterol numbers down. So I think fasting's great, but you know, just don't go more than 3 days on your own, or else you can get all sorts of metabolic problems if you're going full fasting. You're talking about muscle strength? Yeah, so I find a lot of people think they are athletes. For athletes, the key is repair and recovery, right? If you can recover more quickly, repair more quickly, you can train more frequently. A plant-based diet is a very anti-inflammatory diet. It will help you to repair muscle quickly. At the same time, during muscle repair, we need not only protein, but we also need carbohydrates. And those people who are training more frequently, they need more calories overall. There's lots and lots of protein in plant-based foods. Broccoli, 27% of the calories in broccoli come from protein, which is higher than red meat. Spinach is 52% protein by calorie. You can train very, very well on a plant-based diet, and if you're interested in learning more of the science, that Game Changers documentary I think would be really interesting for you. I would actually recommend the book How Not to Die by Michael Greger. He goes through the top 15 causes of death and how they relate to diet. And while we hear in the media, it seems like there's a lot of confusion when the media talks about nutrition. But when you actually look at the science, I don't think there's quite as much confusion. It's a great book. It goes through those top 15 causes of death, and you'll get to the prostate cancer chapter, and you'll say, oh no, I can skip this. But if you don't, if you read all those chapters, even the ones that might not seem relevant to you, you do start to understand some of the common themes. So she is asking, what about people who work erratic schedules, or maybe they're working the night shift? Do those people need to have sort of consistent meals, or how would you counsel them? This research was not done with distinct meals, only food types to choose from. So I did my residency here, which was crazy, and I am not a foodie. I eat to fuel my body, and so I had like sweet potatoes on me at all times, just pop in the microwave, or you can do it very low budget and conveniently. But definitely working the night shift, it means hospital cafeteria options are limited, and it might require some more preparation on your side. She's asking about why did Caldwell-Esselstyn limit caffeine in future iterations of his study. So caffeine is a vasoconstrictor. So in someone who is at very, very high risk for heart attack, the last thing we want is anything that's going to constrict those blood vessels. I like coffee. At our national conference a year ago, every October is the American College of Lifestyle Medicine conference, I had to ask him personally, Caldwell-Esselstyn, can I have 1 cup of coffee every morning? And he says, for a healthy person, yes, 1 cup of coffee is fine. But someone who is at extremely high risk for heart attack probably wants to limit anything that's a vasoconstrictor. I focus on LDL because the total cholesterol, so he's asking, why are we focusing so much on LDL cholesterol and not total cholesterol? So we know our HDL cholesterol is protective. There are some people that have a really high HDL. I think LDL is the bad stuff. And so when we look at those numbers, I think that gives us the clearest picture. Although we do know some of those studies we looked at did look at total cholesterol. But LDL, that's the irritant that's going to cause the damage. So that's the one I like to focus on. So if you guys are interested in diabetes is my favorite just because you can just see the numbers change. In 90 days, you can just see, you can watch yourself reverse your diabetes. Dairy, dairy. Dairy, the #1 source of saturated fat in our diet. When we think about cholesterol and saturated fat, we sort of think about meat first and foremost. But dairy is actually just as bad as meat. And the thing about dairy is that it's addictive. I have so many patients, they're like, I switched to plant-based, but I can't give up my cheese. And I'm like, I know, cheese is addictive. Cheese, I think, is a bigger issue than meat. You can see yourself cutting out meat, but when it comes to dairy, dairy's everywhere. There's cheese on top of our salads, on our sandwiches, in our sauces. I think dairy is more omnipresent and harder for a lot of people to cut out. So definitely not a better option than meat. So he's asking about fasting and can that raise your cholesterol? Once in a while, I'll get a patient either fasting or someone who has switched to a plant-based diet and they're losing weight and they come in and their cholesterol's up, which just doesn't make any sense. It is true that sometimes in the short term, we can see those cholesterol levels rise because as we're fasting or as we switch to a plant-based diet, we're often breaking down some fat and using that as fuel, and cholesterol is what our body uses to transport fat around the body. So once in a while, you'll see an oddly elevated LDL in someone who's either fasting or switching to a plant-based diet, but with compliance and time, adherence to a plant-based diet, those numbers come down. Pasta and rice. Chickpea pasta, also good. So when we talk about a whole foods plant-based diet, whole foods refers to single ingredient foods unprocessed as they exist in nature. So that includes all of our whole grains, our rice, our barley, quinoa, farro, amaranth, etc. And pasta can be a source of confusion. First of all, gluten, not a problem. Pasta, although it seems moderately processed, right? Like to make pasta, we have to break it down to flour and then, dry it all out, take all the water. When we actually cook pasta, we are adding a lot of the water back in. So we are sort of lowering that calorie density again. So when we look at how our body processes pasta compared to a slice of bread, the pasta, it has a nice slow release of energy, whereas the bread is like a sponge and it soaks up those gastric juices and it breaks down all of that glucose pretty quickly. So pasta acts more like a whole grain, like rice, quinoa, farro, etc. So I would say those things are fine. And you have to fuel your body. If you go home and try to eat only vegetables, this is not an only vegetable diet, you will be set up for failure. You do need some starches to satiate yourself and to fuel yourself. Oh yeah, I see patients across the spectrum. I have some patients who are so perfect they should be counseling me, and then I have some patients who are real projects. So, I am a family medicine doctor. I do have some patients who are totally not interested in plant-based diets who come see me. I will say the one point of leverage with the young people is the cholesterol levels. There's a lot of young people who look good, they feel healthy, etc. You look at their lipid panel and their LDL's up at 120. So that is something I work with a lot of young people on. But yes, I do see patients 7 and up, across the spectrum. Okay, thank you so much.